So after a thorough and rigorous review of the currently available published and unpublished data by our regulatory and medical experts, the FDA is granting an emergency use authorization to the COVID-19 vaccine of Sinovac Life Sciences Company, known as SARS-CoV-2 vaccine Verocell inactivated, or yung trade name po niya ay CoronaVac. It is decided that all conditions for an EUA are present and that the benefit of using the vaccine outweighs the known and potential risks. The interim data from the ongoing phase 3 trials show that when the vaccine is used on clinically healthy members of the community aged 18 to 59, it has an efficacy rate of 65.3% to 91.2%. Yung 65.3, yun po yung nakita sa Indonesia, at yung 91.2, yun po yung sa Turkey na kanilang clinical trial. However, it has a lower efficacy rate of 50.4% when used on healthcare workers exposed to COVID-19. Therefore, it is not recommended for use in this group. The vaccine regimen recommended by our experts consists of 2 equal standard doses of 0.5 ml each, given 4 weeks apart. The adverse events reported were transient and mostly mild to moderate, similar to common vaccine reactions. No specific safety concerns were identified, but it must be noted that this only reflects limited follow-up and more adverse effects may emerge. That's why close surveillance and monitoring is needed after the immunization. Additionally, we would like to inform the public that the vaccine is a good option for individuals who have allergies to components of other available vaccines such as yung polyethylene glycol and polysorbate. Hindi po siya nagko-contain nitong mga chemicals that that are usually the ones that cause anaphylaxis and severe allergies. The vaccine produced by Sinovac is also certified halal by the Indonesian authorities. And the following are the salient points of the EUA, including and of course the EUA may be revisited later on and reviewed and revised as we get more data from their ongoing clinical trials. Next slide, please. So the EUA is not a marketing authorization or a certificate of product registration. Therefore, it cannot be sold commercially. Next slide, please. Paalala lang po na hindi pwedeng ibenta. The IP Biotech, yun po yung pangalan ng kanilang local representative, can only sell the vaccine to the Department of Health and the National Task Force or their designated partners in the vaccination program. The vaccine shall be administered only by vaccination providers and used only to prevent COVID-19 in clinically healthy individuals aged 18 to 59 years. The use of the SARS-CoV or the Sinovac vaccine in healthcare workers is not recommended as it has an efficacy of 50.4% in this group. Next slide, please. So we, of course, the stakeholders should administer the Sinovac vaccine in accordance with the EUA. They should provide the recipients of the vaccine with the complete information and obtain a written informed consent prior to vaccination. And as I said, very important, they have to report any adverse events following immunization of the use of the vaccine. Next slide, please. So, ang EUA po natin, as previously announced, is only until the declaration of the public health emergency is lifted or until there is a certificate of product registration of the vaccine. Maraming salamat po.